So we are reading Hands of Light by Barbara Brennan. We are on chapter 15, page number 142 of the book and 160 of the PDF.
Thus, in the disease system, the imbalanced energies in the higher bodies are progressively transmitted down into the lower bodies, eventually causing disease in the physical body.
So what does this imply, right? Everything happens at a higher state of consciousness. Everything happens at the extreme layers, the external layers. The external layers are interpenetrating all the layers. So if it happens in the seventh layer, then it comes into the sixth, fifth, fourth, and so on and so forth until it actually impacts the physical body.
In the disease system, the sensitivity to the body sensations is decreased and can lead to insensitivity to the body's needs, manifesting through improper diet, for example, which can create a negative feedback loop of more imbalanced energies. Each body that is disrupted or imbalanced also has a disruptive effect on the neighbor above it. This disease tends to create more disease.
So again, everything affects everything else, and proximity will naturally affect it more. So if there's an imbalance, it will cause an imbalance in the entire system. So that's where awareness also starts to come in, right? Where are we operating from? Becomes very, very important question that we need to ask ourselves.
The observations I have made through high sense perception show that on the even-numbered layers of the field, disease takes the form of the blocks described earlier in this book: undercharged, overcharged, or clogged dark energy.
So again, when we observe people, we can see these blobs of energy, right? That a dark field has taken over the person. And this can be even seen in the aura photographs, where a darkness is there in the system. Blobs can start taking place.
On the structured layers of the field, disease takes the form of disfiguration, disruption, or entanglement. There may be holes in the grid structure on any of the odd-numbered layers of the aura.
So this is also something seen whereby, when a person is, let's say, a druggie, right? You actually see these holes in the aura, in the structure of the auric field.
Drug affects the aura a great deal. I have seen dark energy forms in the liver left from drugs taken for various previous diseases. Hepatitis leaves an orange-yellow color in the liver years after the disease is supposedly cured. I have seen the radiopaque dye used to observe the spine that was injected into the spinal column to diagnose injury 10 years after injection, although it is supposed to be cleared by the body in a month or two.
So the residue of these drugs, when I was talking about drugs, I meant cocaine and all that other stuff. But even the normal, regular drugs leaves residues in the system, whether we like it or not, right? Things cannot be cleared totally from the system, and even if the physical matter is cleared, the energetic imprint still remains in the body system.
Chemotherapy clogs the whole auric field, but especially the liver, with greenish-brown mucus-like energy. Radiation therapy frays the structured layers of the auric field like a burned nylon stocking. Surgery causes scars in the first layer of the field and sometimes all the way to the seventh layer.
So again, we have seen, right, chemotherapy will clog, radiation will burn into the system, and operations, whenever you have an operation, your physical body may heal, but at the energetic level, the cut is still there. So we can actually see people leaking energy until it is sealed, that where the cut is in the auric field needs to be sealed.
These scars, disfigurations, and clogs can be healed by helping the physical body heal itself. If they are left distorted, the physical body will have a much more difficult time healing itself. When an organ is removed, the etheric organ can still be reconstructed and serve to keep harmony in the auric bodies above the physical body.
What does this imply, right? The imprint, the energetic imprint of all the organs that we have in the physical body are there in all the layers of the aura, right? So again, even if the physical body, the physical organ is removed, the imprint remains. It is also very much like the phantom limb, where a person loses the arm, but still feels that the full arm is there, because in the etheric levels, in the auric field, the arm is actually existing in all the levels of the aura.
I would imagine that someday, with more knowledge of the auric field and biochemistry, we may be able to cause organs that have been removed to grow again.
Yeah, now, so this is something that Robert Becker, he talks about in his book called Body Electric, right? He has actually been able to grow the arms of an amputated person back using electrical conduction and reversal of polarity. Whenever a salamander or a chipkali that we call that lives around here, that it grows the tail back, it's because of the reversal of the electrical potential where the wound is, right? So this is something that can actually happen, but it's a very tedious and a long process. So naturally, it does not come into vogue.
Since the chakras are the points of maximum energy intake, they are very important focal points of balance within the energy system. If a chakra is imbalanced, disease will result. The more imbalanced a chakra is, the more serious the disease.
Okay, so we keep repeating this, but basically the chakras are vibrating vortexes of energy, and they are absorbing energy from the environment through the principle of resonance. Now, naturally, if the chakra is not functioning properly, then that particular frequency of energy is not coming into the body system, and it will naturally cause an imbalance in the system. It's like, having food without salt. Now, if you don't have the salt or the sweet, you need all the 7 tastes, right? If you don't have all the tastes, then you're not going to really enjoy the food properly. So likewise, if the frequency of energy is not coming into the system, it will naturally cause disease because there's an imbalance in the energy intake of the body system.
As shown in chapter 8, the chakras appear to be vortices of energy made up of a number of smaller spiral cones of energy. Adult chakras have a protective screen over them. In a healthy system, these spiral cones spin rhythmically in synchronicity with the others, drawing energy from the UEF into their center for the body's use. Each cone is tuned to a specific frequency that the body needs to function healthfully. However, in a disease system, these vortices do not work synchronistically.
So again, each of the chakras have to work in synchronization with each other, right? The required amount of each frequency of energy needs to come into the system. Now, if one is working harder than the other or faster than the other and absorbing more, again, it can create imbalances in the system. This is something that we read in the last chapter, where various kinds of people are there, right? The psychopath, etc., etc. And we also saw that in each kind of a personality or in each kind of a characteristic, certain chakras are open and certain chakras are not open. So that results in the imbalance of that character that we are talking about.
The spiral cones of energy that make up these vortices may be fast or slow, jerky or lopsided. Sometimes break in the energy patterns can be observed. A spiral cone may be fully or partially collapsed or inverted. These disturbances are related to some dysfunction or pathology of the physical body in that area. For example, in the case of a brain disorder, Shafika Karagula observed in Breakthrough to Creativity that one of the smaller vortices of the crown chakra was drooping down instead of standing upward in a manner she had found to be normal. The matrix within the brain of the individual also showed gaps where the energy had to jump across. This spark gap corresponded to the part of the brain that had been surgically removed. John Pierrakos, in the case of the broken heart, reports observing disorder in the heart chakras of patients with angina pectoris and coronary heart disease. The chakras, instead of being bright, whirling vortices, appear to be clogged with a dark, sluggish substance.
So basically what happens if the chakra is not functioning properly and the sub-chakras or the smaller vortexes within the chakra or the micro chakras are not functioning properly, they can cause imbalances in specific organs in the body system. This is something that we learned a lot when we had the talks by Shyamji Bhatnagar, and his book, The Micro Chakras, is very, very good in this, right? So he could actually see that which micro chakra is not working properly, which will result in a certain imbalance. And when you start rectifying the flow of energy through the micro chakras, then automatically that issue that you are facing, that gets taken care of, right? So the micro chakras become very, very important. I mean, the chakras within the chakras, the smaller spirals within the chakra.
Some specific examples of my observations of disfigured chakras are given in figure 15.5. The first shows the configuration of every hiatal hernia I have observed. The solar plexus chakra has 8 smaller vortices. The small vortex, located on the left side of the body in the upper left quadrant, looks like a spring that has been sprung.
Just 1 second, Shiva. Someone's making a racket. 1 second.
The solar plexus chakra has 8 smaller vortices. The small vortex located on the left side of the body in the upper left quadrant looks like a spring that has been sprung. This disfiguration appears all the way out to the 7th layer of the field. Figure 15.5b shows the tip of one of the smaller vortices has been pulled out. I have witnessed this in many chakras. It appears in the first chakra when there has been some damage to the coccyx. It appears in the solar plexus chakra when there has been a severe psychological trauma. Many times, it appears as a post-surgical trauma in a chakra in the area where the surgery has been performed. Figure 15.5c is a clogged chakra. Everyone who has angina has clogged, darkened energy in the heart chakra. The 3 people who have AIDS that I have observed have the first and second chakras clogged, and sometimes the entire field, including all 7 layers, depending on how far the disease has progressed. A torn chakra, like that shown in figure 15.5d, has appeared in every cancer patient I have seen. Again, the configurations listed here go out to the 7th layer. A chakra can be torn, and the cancer may not appear in the body until 2 or more years later.
So what does this prove, right? That if there is an imbalance in the energy field or in the auric field, it may not come down into the physical body years later, but if it can be observed there, it can be healed at the auric level. So then it doesn't need to come as a disease into the physical body.
The protective shield is completely ripped away from this chakra. In people who have very serious forms of cancer, I have seen the seventh layer torn from the feet all the way through chakras 1, 2, and 3 and into the heart chakra. The effect of a torn seventh layer is loss of a lot of energy from the field. In addition to energy loss, the patient is subject to all kinds of outside influences, not that affect him not only psychologically, but physically. The field is unable to repel incoming energies that are not healthy for the system to assimilate. Figure 15.5e shows an example where the entire chakra is pulled to one side. I have seen this often in the first chakra, where people have connected their energy to the ground mainly through one leg, while the other leg is weak. This is also usually associated with a coccyx that has been jammed over to one side. I am beginning to think that each vortex of a chakra supplies a specific organ with energy. I have noticed that every time there is a disturbance in the pancreas, there is also a disturbance in a certain vortex on the left side of the solar plexus chakra, just below the one associated with height and body. Whereas when the disturbance is in the liver, a different vortex in the same chakra is affected, one near the liver.
So what does this imply, right? All these vortexes are working at different frequencies and they are connected with different organs. So every chakra is connected with an organic system in the body, and it actually helps and supports running and maintaining that particular aspect of our body running properly. So if the chakra is damaged, it will show up as a damage at the physical level also at some point in time.
Figure 15.5f shows a disfiguration that occurred from a heavy therapy marathon. After spending a week in group therapy with her son, who is a drug addict, this woman came home with one vortex of the solar plexus chakra wedged open. It was pale with almost no spin and no protective screen. Since I saw the problem the week after the experience, I was able to repair the aura before additional damage occurred. If I had not, eventually this woman would have had problems in the liver, the organ related to the weakened vortex, or she would have healed it somehow herself.
So self-healing also does take place. It's not that it doesn't take place, but if we can have help and we have testing processes to actually test it and see what is happening, it can always be a much bigger help and support system.
There are many more configurations that can occur. Many, as you can see, are simple structural misalignments. I have seen chakras that are actually pulled inside out, greatly expanded or greatly reduced in size. All eventually result in disease, and all are related to an energy consciousness or expression of the individual's belief system and experience. As discussed earlier, in other words, disease at any layer of the field will express itself in that level of consciousness. Each expression is some form of pain, be it physical, emotional, mental, or spiritual. Pain is the built-in mechanism that alerts us to correct a situation. It brings our attention to the fact that something is wrong and makes us do something about it. If we have not listened to ourselves before, if we have continued to ignore what we know we want or need to do, eventually pain will help us do it. Pain teaches us to ask for help and healing and is therefore a key to the education of the soul.
So again, asking for help, right? If we do not know what we need help for, we cannot ask for it. That's why all these senses all these perceptions become so important for us.
Exercise to find the personal meaning of your illness. A key question in this healing education process is, what does this illness mean to me? What is the message to me from my body? How have I forgotten who I am? The disease is a specific answer to the question, how does this pain serve me?
So now this is important, right? Anything that happens to us happens for a reason. It's there to teach us something. It's there for us to grow and learn from. So even a disease that we have is there to teach us something. So again, asking the right question becomes very, very important. The moment you ask the right question and get an answer which serves you, then what happens is that the healing process automatically starts to take place.
We all create disease to some extent in our physical bodies. If you look back at the original cause, it is always based on forgetting who we are. As long as we believe that we must be separated in order to individuate, we will continue to create disease. Again, we are right back to where we started from, the holistic or holographic view of the universe.
So basically, all disease is caused when we are moving off track, when we are not on the path, we are not on the flow, we are not doing what we were brought here to do, right? And we forget, and we do not understand that everything is interrelated and interconnected. Nothing is disconnected from the other thing. So we live in a holographic or a universe which is connected with oneness and wholeness. Right. Shivamala, just go backwards. We'll see the chakras once. Yeah. So again, the A diagram is when one of the minor chakras or the smaller vortexes has sprung a leak, right? It's moved out of position. The B one, it has got detached. One of those smaller vortexes has got detached. The third one, that is C, has got clogged. The fourth one is the cancerous chakra. The fifth one, that is E, has fallen down. It's gone out of shape. And the last one, the sieve, which covers is the protective layer, which doesn't allow stuff to come into the chakra, which is not relevant to the body. That sieve has got removed. So anything and everything can come into the system. So these are the 6 depictions that she has made over here.
Bhaiya, what was the D?
The D is cancerous.
Okay.
But Nikesh,
Yes,
what is the meaning of each of these chakras? Like what happens when
so these can happen to any of the chakras.
Okay, but what happens exactly?
Yeah, so that's exactly what we read over here, right?
Okay.
So if you see figure 15.5F shows a disfiguration that occurred from a heavy therapy marathon that the mother attended with the son. So it stretched her limit, which caused this sieve to get out and create a problem, right? If you see, she's just described each one of them. Let's go through it. The pictures, it will become better.
With the picture, if we can do it.
So if you see figure 5A shows the configuration of every hiatal hernia that I have observed. The solar plexus chakra has 8 smaller vortexes. The smaller vortex located on the left side of the body in the upper left quadrant looks like a spring has been sprung. So this is caused by hiatus hernia, or rather hiatus hernia is caused by this. Now, which one comes first? We don't know. Right. The B shows one of the tips of the smaller vortexes has been pulled out. I have witnessed this in many chakras. It appears that the first chakra, when there has been some damage at the coccyx level. It appears in the solar plexus chakra when there has been a severe psychological trauma. Okay. That means this smaller vortex has got pulled out of the mainstream. which doesn't allow this frequency of energy to come into the mainstream and then result in even more problems. This is a clogged chakra. So she says that a person who has heart problems or angina will have the clogged chakra. Okay. People who have AIDS, she says that the first, second chakra are clogged, and sometimes the entire field is also clogged. The D chakra shows, it appears in every cancer patient I have seen. Again, the configuration list goes out to the seventh layer. So each of these chakras, it is not only on the first layer of the body. It is in all the layers of the body. This was seen in the pictures that we've sent. We posted it on the WhatsApp group also. Yeah. That each of these chakras, they are in all the layers. So it has it in the first layer, second layer, third layer, fourth layer. Now, where the damage has taken place can also have its own connotation and its own meaning. Okay. So that was D. And then E, basically E shows an example where the entire chakra is pulled to one side. I have often seen this in the first chakra where people have connected their energy to the ground mainly through one leg. So there's some kind of an imbalance in the system where they are focusing more on one leg than the other. So there is more energy on one side of the body system rather than the other. And the last one we've already discussed.
Yeah, thank you.
Okay.
Correct this fallen chakra. I mean,
yes, Asha aunty.
How do you correct this? Like you're fallen. How do you correct these chakras?
Yeah, so now that's what we are going to be learning, right? In the book coming across. Again, the more in equanimity that we can be, the more in sync we can be, the more on right side of the grid we can be, then automatic self-correction starts to take place over a period of time. And this is something that we have seen in Astha's program also, where the corrections can take place. Now, just to put in a word here, we are going forward with the Astha program. We just need to confirm how many people would like to register. She needs a minimum of 10 people to continue. So we are going to, we are working at first. We need the confirmation of the number of people, and then we can go ahead because she's asking for a price for that. So we'll have to work it out.
Actually, I'm out from 26.
We'll talk about it separately.
Yeah. Okay.
So what is the Astha? Sorry.
Astha Gulati, we've done some programs on chakra healing with her. On 7 chakra mastery, etc. Sorry. He wants to take it forward with the minor chakras and all that stuff.
Thank you.
Yeah.
Bhaiya, we've already confirmed it, no? Or do
No. So we have only 14. We have 14 people. Now we are going to get in touch with everyone who all would like to pay for the program, right? So she's asking for a packet for that. So that we need to figure out how to do it.
Bhaiya, there are a few people who want to even do it, but haven't done the first. So can you not ask her if that is also possible?
Yeah, that is another possibility which we are looking at.
Because then they can confirm on this that they'd like to do it.
Yeah, we are working on that also. Just not had the time. We will be working.
Okay. So should we ask those people also to put it on the group?
Yeah, please do that.
Okay.
Maybe she can do a combination like you had the Vastu program, 1, 2, 3, 4. Then you can have the beginning for those who not done it, and the rest who've done it can just join on to the B portion of it.
Yeah. We are working on it.
And maybe we can also attend the first ones again.
Yeah. So we'll work on that.
Okay. Thank you, Bhaiya.
Thank you.
Chapter 16, the process of healing, an overview. What the healer has to offer the patient and the medical profession are 3 things: a different and broadened view of the causes and cures of disease, access to information about any given life or medical situation that may not be available through other means, and working directly with the patient to enhance the patient's healing abilities. No matter how miraculous the result, the healer really induces the patient to heal himself through natural processes, even though they are beyond what is considered to be natural for those who are not familiar with healing. Your body and your energy system move naturally towards health. The healer.
So what does this imply, right? By this higher sense perception, we can actually give information to the client, to the patient, to the person who's facing an issue, which is beyond normal allopathic means. And that can actually enhance the well-being of the patient. Ultimately, the body always wants to come into a state of well-being. It doesn't want to stay in a state of disease. It does not want to stay in a state of imbalance, provided we allow or give the platform to the body to be able to heal itself and come into something which Zianath calls homeostasis, that is internal balance where everything is functioning in the proper way.
The healer has ways and means to evoke health. The physician, of course, also works with these principles, but the burden of so many impersonal cases and constantly being faced with illness, many medical doctors become oriented towards the cure of a specific set of symptoms, which sometimes may not be the same as orientation towards health.
So basically, what the allopathic doctors are treating is the symptom, right? But when you look at the hierarchy of how a symptom appears, first there's a stress in the system. The stress will cause a discomfort or a dis-ease. The dis-ease will cause the disease, and the disease will cause the symptom to appear. So if we are dealing with the symptom, we are not dealing with the cause, which is the stress. So if I have a headache and I take pop-up pill to get rid of the headache, I am not taking care of the cause, which may be that my blood pressure is high, right? But I've taken a pill to just get rid of the headache, but not dealt with the cause, which is blood pressure. I'm just taking an ad hoc example over here. I'm not saying that the blood pressure will always cause a headache, but it is basically something like that. Okay, so when we are looking at healing with real wellness, we deal with the cause, not the symptom.
To the healer, health not only means health in the physical body, but also balance and harmony in all parts of life. The process of healing is really a process of remembering who you are. Within the aura, the process of healing is a process that rebalances the energies in each body. When all the energies in each body are balanced, health occurs. The soul has learned its particular lesson and therefore has many more cosmic truth.
So ultimately, it's a call. The point is of coming in sync, coming into the flow, remembering who you are. What does that imply? That what have I come here for? What is the life path that I have chosen for myself? Disease occurs generally when we shift from the life path that we have chosen for ourselves. When we come here and we are in that expanded state of consciousness.
There are two major approaches to healing today. One is inner healing, which establishes balance and health in all levels of the person by focusing on and dealing directly with the physical, emotional, mental, and spiritual aspects of the human being, how he creates his belief systems and reality. The other is outer healing, which helps re-establish balance in the different layers of the aura, including the physical body systems, by applying energy distilled from the universal energy field.
So again, what does this imply, right? That today, basically, what are we looking for? We are looking for that inner healing, which balances us at the physical, mental, emotional, as well as spiritual levels, all 4 levels of the field. Now, when we are looking with the Lecker antenna, we can actually check which aspect of the healing is required, whether it's at the emotional level, the mental level, the physical level, or the spiritual level. Now, if I'm attempting to heal something at the physical level, but the problem is at the mental level, then healing will not take place in the way that we would like it to take place. So if we can get a sense of understanding and have tools to be able to assess where the problem actually lies, it becomes easier to bring healing into the system.
I suggest the inner healing is most important, but that the outer healing methods are needed to supplement this process. The process of inner healing. The process of inner healing rebalances the energies in each body by focusing on the expression of that imbalance, correcting it and repairing the appropriate layer of the aura through laying on of hands. This realignment in each body helps re-establish balance in the others.
So again, once laying of hands, right? We have chakras in the hand also. So when we lay hands, there's a therapeutic touch which takes place. Today, if any mother will know, right? When a child falls or has pain or something, the first instinctive thing you do is you lay your hand on that. You put your hands on that. You put your hand on the head, right? Wherever the child is hurt, you put the hand over that so that the healing starts to take place. So what she's saying here is the method that is used in the Hands of Light process or in Barbara Brennan's School of Healing is basically laying of hands.
The process of inner healing, called full spectrum healing, is discussed at length in chapter 22. Here we briefly describe it. In the healing of the Ketheric template level, the faulty belief system is brought to consciousness and challenged.
So many of our issues that we face in life are because of the belief systems that we have. Again, Robert Monroe also talks about this in the Gateway Voyage very, very clearly. And that's the first step to actually becoming what we are, and connecting with what we have come here to do is to transcend our belief systems, right? Because that is where the real problem starts.
In the healing of the Ketheric template level, the faulty belief system is brought to consciousness and challenged. Healing is done on the 7th layer of the field. This healing consists mainly of repairing and restructuring this body wherever needed. Repair of the 7th layer automatically opens the 6th layer for more celestial love.
So again, as we heal the outer layers, the inner layers automatically start to get healed because everything starts from the outermost layer.
On the celestial level, the healer sits in celestial or universal love and simply channels it to the patient. On the etheric template level, the auric body is realigned through spiritual surgery. This has the effect of realigning the will to the divine will.
So again, your personal will to align to the divine will, which means getting into the flow, right? And that healing also needs to take place at a psychic level. So psychic surgery can also take place.
On the astral level, healing takes place through chelation and love. The healer sits in the reality of love of humanity and channels energy to the patient. This allows the mental level to begin relaxing and letting go of some defenses.
So at the astral level, again, it's about safety. It's about feeling secure, right? Once that security comes in, then the letting go also starts happening. Mainly, a lot of our problems are caused because of attachment to belief systems, attachment to our physical body, attachment to a person, attachment to a place. it can cause lots of issues. So when we start letting go of our attachments, that can have a tremendous releasing effect in our entire field.
On the mental layer, the healer challenges the faulty thinking processes that create imbalance on that level. These thinking processes are based on the logic of the child who experienced the trauma. When the adult becomes aware of them, they are easily seen for what they are and can be replaced by more mature thinking processes. The healer works to restructure that layer of the auric field by helping the client to imagine new solutions to old problems.
So again, this is something that we work a lot within the biofield tuning process when we are doing the timeline, that today a child has experienced a traumatic event, right? But the child is experiencing it from the mentality of a child and doesn't understand the bigger connotations or what it really means. Now, as an adult, because you've matured, if the same incident took place in your life, you would not care about it. But for a child, it was a big thing. So when we go back to that event, which happened, which was very traumatic for the child, and observe it from the attitude or the mental attributes of an adult, right? We understand that this is no longer relevant, and that energy which is stuck there starts to dissolve and can be reintegrated into the system for use by the system. So basically what we are doing is we are understanding the old problem from a new paradigm, and we can integrate the old stuff. That trauma gets dissolved.
On the emotional layer, using a chelation technique, the healer helps the client to clear blocked feelings. Sometimes the patient relives old traumas and experiences all the blocked feelings during the healing. Sometimes the traumas are removed without the patients becoming aware of them.
So, right. So when the healing takes place, at times the person can actually feel, like vibrations can take place. You can start feeling pain. You can start feeling emotional overwhelm, which can start happening, right? Tears can start coming, and that healing can take place. And many times the healing takes place without the client actually knowing what is happening. This happens a lot in the meditations also. Sometimes people will just simply find tears rolling down their eyes and they don't know why the tears are coming. So that definitely when that happens, there's some kind of a healing which is taking place, right? So again, the emotional blocks are getting cleared off at this level.
On the etheric layer, there is straightening and repair to be done to restructure that layer to re-establish a sense of well-being and strength. To work directly on the physical body, exercises, body positions, and voice are used to release physical blocks. For example, muscle tension, fat, or weakness.
So again, so that's what I keep telling people, taking massages, with the Lo-Fan, just rubbing your body becomes very, very important if you want to release the stresses in the body system. Again, resonant tuning, right? What she says over here, using the voice are used in releasing the trauma. So resonant tuning can become a very, very powerful tool. And strictly speaking, I'm using resonant tuning a lot now because I find that it really helps in releasing the blocks and also raising the energy level of the client as well as myself when I'm doing the sessions that we are taking. Right. So massage becomes a very important therapy in this process. Exercise, of course, is important. She's going to, I think, take us through some exercises which can actually release the energy blocks, etc. also. So again, exercise and moving the body becomes important.
In the process of full spectrum healing, all the bodies are worked on together. This process is done in private sessions or sometimes in groups with the healer. In this process, health in the physical body usually appears last. after the other bodies have been balanced. This may take one session or a year of sessions.
So again, the healing happens at the etheric level first before it happens in the physical. So it will first happen in the 7th, then in the 6th, then in the 5th. But depending on where the imbalance or the problem lies. So if we can get a sense perception of where the problem is, naturally you can tone into that area and then heal it from that state of consciousness.
You may wonder how healers can do all this. It is because they have access to an enormous amount of information through an expanded state of consciousness.
So again, the key is an expanded state of consciousness, right? Which we are talking about all the time, going into F10, going into F12, 15, 21, so on and so forth.
The process of outer healing. To enhance and accelerate this basic healing, outer healing methods are used and in many cases very much needed. For the physical symptoms generated by the faulty belief systems cannot be left alone until the belief system is corrected.
So naturally, many times what happens is that the belief system cannot be corrected, but the faults being caused by the belief system can start to get corrected, and that will support the overcoming of the belief system. This is again what we are doing in the biofield tuning sessions, or when we are saying that, okay, go join the workshops, right? When you join a workshop, you're taken into an altered state of consciousness. Now the problem is vibrating at this level, but you've gone into an altered state. Now this level of consciousness where the problem lies, this problem will not affect you when you are in this state. So this automatically starts to get healed, which is why I call the Hemi-Sync process or the Monroe process a Jhadu Marna process. It sweeps your system clean automatically. So you may not even know what is getting cleared up, but things start to get cleared up.
It is sometimes necessary to provide outer healing to save the person's life. However, if the inner healing is not also done and the faulty belief system not challenged, illness will again precipitate into the physical body, even after present symptoms have been removed.
So this is what I found, right? That if the person doesn't change the way that they are acting, the way that they are operating, even if you heal the person, the problem will revert, right? So changes in the way that you're living lifestyle changes are very much required for real healing to take place.
With the advancement of the practice of holistic medicine, many healing methods are being developed and are proving to be reliable. Many physicians are emphasizing diet, food supplements like vitamins and minerals, exercise, and health maintenance programs to keep people healthy. Healthcare professionals like homeopaths, chiropractors, acupuncturists, kinesiologists, masseuses, and other body workers are practicing all over the country to help people maintain their health. People are becoming more conscious of regular fitness programs, of exercise and regular health checkups to catch any possible difficulty before it becomes serious. Laying on of hands healing is now being practiced around the country in many forms. People are interested in shamanism and other ancient forms of healing. Psychic surgeons regularly visit this country and work with hundreds of people. We are in a healthcare revolution. Why?
So psychic surgeons are surgeons. These people, they actually do an operation without any gadgets. They'll just use their hands to cut and then take out a diseased organ or take out the disease, right? This happens a lot in the Philippines. There was one doctor also, he had written a book, The Psychic Surgeon. He used to operate somewhere in the UK. In fact, when I went to UK, I went to the place which was written in the book, but that place was locked up. So, but this happens regularly, I know, in the Philippines, and it also happens a lot in Brazil, where this John of God is there, and he does all kinds of psychic surgery. If you go into the internet and psychic surgery, you'll find a lot of material over there.
With the advent of modern technology and the loss of the family doctor, medicine became depersonalized. The family doctor took responsibility for a family's health by being familiar with the family's history, sometimes for generations. Today, a physician can't even remember the names of his patients because he has so many. With this change to what it is many times a wonderful technology that saves many lives, the physician cannot possibly take responsibility for each patient's health. That responsibility has fallen back on the patient himself, where it ought to be. This is the basis for the healthcare revolution. Many people want to take more responsibility now for their health. To make this change a smooth one, the best way is to integrate the methods that are available so that healing can become very personal again, as it was at one time in our history.
So of course, previously you used to have a family doctor, and the doctor would have, worked with maybe 4 generations of the family. So they knew the history, what are the indications, what happens in the family. The doctor has been seeing the patient since the patient was a child. So he has familiarity with the patient. He knows the pulse of the patient, right? What the patient is going through. Now, naturally, with the specialization coming in and also so many patients to a doctor, that becomes impossible. Previously, the family doctor used to be a friend of the family, right? They became a part of the family. Now the doctor it's very impersonal, and the doctor doesn't remain. Of course, in some cases you invite the doctor to various occasions, etc. But generally speaking, is not a friend of the family because the doctor doesn't know everyone, right? I think we can stop here. It's 1 o'clock.